Why is minority health important? My name is Dr. Erica Steele. I am a holistic doctor in family practice. I hold 6 degrees in my field. They're all in the natural healthcare space. I am a drugless doctor, and I went to school so you don't have to. So let's jump into it. So why is minority health so important? Really, it's because everyone deserves equal access to healthcare, but especially minorities. Health disparities among minorities also have significant impact on our society as well as economy and increased healthcare cost and reduced productivity overall. So by promoting health equity and addressing these health disparities, we can improve the health and well-being for everyone. Minority health is essential because it highlights the importance of ensuring that everyone, regardless of race, ethnicity, or social economic status, has access to quality healthcare services. And in my view, health education is absolutely number one. Health disparities among minorities have a significant impact on our society as well as our economy. So for instance, healthcare disparities result in increased healthcare costs due to a need for more intensive care and increased healthcare utilization. Additionally, healthcare disparities can result in reduced productivity in work, missed work days, increased absenteeism, which can impact the economy as a whole, driving healthcare costs in general as people are running to the ER and overinflating our healthcare cost. So it's not only a social justice issue, but also a matter of public health. And so as we address these health disparities among minorities, it's critical in improving the overall health and well-being of our entire population. We can help reduce the burden of chronic diseases and other conditions on families, individuals, and also our communities. So as we promote minority health, they can have positive impacts on reducing healthcare costs and improving our economy. Addressing these disparities among minorities, we can improve our overall health and well-being, which can lead to reduced healthcare costs and increased productivity overall. After all, minorities are an increasing population and really the backbone of our country. Promoting health equity can lead to reduced healthcare disparities and better health outcomes for everyone. I know that it can be a bit of a difficult pill to swallow, especially if you're non-minority, to think, oh, working on building up these health disparities can help our overall economy. But really, it's a matter of everyone having equal access. And I'm not saying that free healthcare for everyone. I'm not even a proponent of more socialized healthcare. What I am a proponent of is educating our general population and helping to promote better health outcomes by empowering people. If we begin to empower people and educate people who otherwise wouldn't have access to that information, then we are able to work on things within our healthcare system, such as reducing those healthcare costs, reducing the need for some of these more catastrophic events. Simple things like educating about water, educating about and also access to healthy water. There are some populations in this country that absolutely don't even have access to healthy water right now, minorities and non-minorities. So improving education on nutrition, teaching people it's not about a diet, it's not about a fad, it's about quality nutrition, our proteins, our fats, and our carbohydrates, and making sure people understand the purpose of quality nutrition. The educating about the importance of mental health, emotional health, and taking those conversations out of a taboo is really important for overall mental health and well-being, because minorities suffer the most when it comes to mental and emotional healthcare conditions based off of transgenerational traumas, which is trauma that has been passed down in the DNA, but also too because of so many different systematic and microaggressions that exist in our everyday world. Me, even being a mixed race person, had really no concept of that because I didn't really grow up in those spaces. But me, as I got older and I met more people and I learned more, I really got to understand the impact of these things when wildly I was unaware of it, and I had a lot of my own cultural biases just because I didn't grow up in those particular communities. Reaching out into those communities and really understanding and listening what the challenges were and really being a good educator and supporter has allowed me to really open myself up to whole new levels of awarenesses. And so these communities are communities that have less access and less education and are far more isolated, really need the greater support. Really, it's all about the weakest link in the population. Not to say those people are the weakest, but to say that if our minority communities, myself included with that, if we don't get the education, the support, and the health equities that we absolutely need, then eventually the entire economy is not going to be able to be supportive, because our rising healthcare costs are being drained by those people who unfortunately are undereducated and underserved in those populations. So hopefully that makes sense. Please comment below any of your comments, questions, concerns. I'd love to continue the discussion about this.